Okay, welcome back to FMR Therapy. Once again, we're doing some knee stuff. It's JC with you today, and we're going to talk about restoring knee flexion. This is just one demonstration out of many to help you with restoring your knee flexion, right? Extension, flexion, extension, flexion. So one of the things that needs to happen when our knee is flexing is that the bone needs to rotate in order for that flexion to happen. There's this little mechanism that goes down. But what if that's not happening and that bone isn't quite rotating appropriately in order to get us into that flexion position? That might stunt our ability to flex. So first things first, if you haven't already checked out my video on trying to release those tissues in the back of the knee, or at least show them some love, right? Then we're going to get a ball, we're going to get back there, boom, we're going to compress, right? There's a little bit of rotating we can do in there. I also talked about getting a towel, right? Putting something like that behind the knee and also compressing. And now we're just flexion gapping. We're just pulling those bones apart and really just trying to make room in there. So we would start with that, a little bit of love with the tissues behind the knee, a little bit of gapping in the knee. Then we're going to switch over to our compression band. So you're going to wrap the whole knee here. I'm going to start below the knee, down there where that tendon is, that patellar tendon. And we're just going to wrap with a pretty snug sensation here, nothing too crazy. I'm not pulling really hard. I just want to get the joint to be able to get compressed by this band. And now we're going to work on rotating that knee. So if I'm coming into flexion of this knee, then an exaggeration of what this bone should do would be external rotation. So a rotation of my shin bone going out, right, as I move into flexion. So what I'm going to do is I'm just going to lunge forward. I'm grabbing my shin bone, so I'm below my knee here, grabbing onto this band with my hands in a circle, and I'm just grabbing that bone, and I'm just forcing that bone into external rotation as I move my knee into deeper flexion. So I'm just facilitating a movement that should be happening anyway, and I'm just kind of getting a little bit deeper into that rotation just to make it a little smoother as I go into knee flexion, right? So again, I'm rotating out. I release as I come up and away from that. And then as I go into a deeper knee flexion, rotate out, release, rotate out. Spend like 30 seconds, 45 seconds, something like that, just going back and forth, after you have loosened up those tissues on the back of the knee and flexion gapped the knee a little bit. Then work on a little bit of that rotation outward as your knee is going into that bending position. See if that helps with any of your knee discomfort. Thanks for sticking around. See you next time.